Thank you everybody for being here today. It's really excellent to be at another APPSA workshop, although it's not in person this time. Apologies for that. I unfortunately had other engagements in Johannesburg, so I had to do the best I could, which is this recording. Today I'm going to be talking about immediate use steam sterilization, or as we used to know it, flash sterilization. What will we cover today? Let's have a look. We're going to remind ourselves about steam sterilization, how it works, how it kills microorganisms. Then we're going to look at some detail of the three main types of sterilization cycles. They are known as the B cycle, the N cycle, and the S cycle. And then the next thing we want to cover is if you really and truly have to use immediate use steam sterilization, what are the rules to follow? Then we'll take a look at some of the research and the guidelines that have been published over the years around immediate use steam sterilization. And then lastly, but really, really importantly, is again, if you are using steam sterilization, what should you be documenting? What logbooks should you be using or recording? How will you validate the cycle? What is your means of quality assurance? Very important aspects to consider. Alrighty, let's dive into this. So I'm sure you remember that the purpose of sterilization is to destroy all microorganisms, because of course, if left on a pack, a microorganism, or if left on a pack or a device or an instrument, a microorganism can cause an infection. Sterilization is defined as a process that renders an object free from viable microorganisms like viruses and bacteria. At the end of the day, after sterilization, of course, there is less than 1 in a million chance that a viable microorganism is present on a device. And that's our whole goal, isn't it? To kill all of the microorganisms. And that term encompasses, or this description encompasses all forms of sterilization. But let's focus now on steam sterilization specifically. Steam sterilization is, of course, steam that comes out through this autoclave. As the steam makes contact with the cold surfaces in the autoclave, it condenses and forms water. Thermal energy is transferred from the steam to the microorganisms, and this coagulates the protein in the cells of the microorganisms. This thermal energy coagulating the protein's name, which actually kills the microorganisms, is known as denaturation. So that's how it is that steam gets to kill microorganisms. Of course, low temperature sterilizers don't use steam, they use a chemical, and the method of kill is slightly different. But with steam, we're killing the proteins by the cells by coagulating the proteins. So with steam sterilization, we're talking, of course, about an autoclave. If you think about it, we're going to take our instruments, we're going to clean them, we're going to inspect them, we're going to wrap them in some form of sterile barrier system. We're going to open the door to the autoclave, we're going to pack the autoclave or steam sterilizer, we're going to close the door, and we're going to press the button to start. So there are three main phases to steam sterilization. So let's have a look at those phases by looking on the graph. The first phase is the conditioning phase. This section over here where I've got these sawtooth marks. Conditioning. In the conditioning phase, air is drawn out from the chamber and steam is pulsed in. So air is drawn in, steam is pulsed in. That's my what the arrows indicate over here. Air drawn out, steam is pulsed in. At the end of the day, we've got to get all of the air out of the chamber. And the process is repeated a few times until all the air is out and we've reached the correct temperature and the correct pressure within the chamber, which would now be at this point over here. Then we begin the next phase, or the second phase, which is actually the sterilization phase. During the sterilization phase, all the items or devices in the sterilizer are exposed to steam for generally around 3.5 minutes to kill the microorganisms, because that's how long it takes. The third phase over here, now that of course is the drying phase. During the drying phase, the chamber is exhausted, which means we pull out all of the steam. We return to atmospheric pressure, and maybe we draw a deep vacuum or we circulate air through the chamber, depending on your make and model of steam sterilizer, so that at the end of the day, we can dry the packs, because as we said, it's a very thermal process, so it's quite warm. Rightio, so steam sterilization, now we know how it works, or at least reminded ourselves of how it works. Now let's have a look at the three main cycles or types of cycles that we have. The first one we're going to talk about is the type B sterilization cycle, and that's the one that I've already described to you now. So that is the cycle with the pump and the vacuum that removes air. So there's actually a suction that removes the air physically. The next one to talk about now is this N cycle, and the N cycle is indeed the flash sterilization cycle, or the immediate use steam sterilization cycle, and it's also known as a gravity displacement process. There's also three phases. Look at the top here: conditioning, sterilizing, and drying. In the first phase of conditioning over here, the steam is pumped into the autoclave. That's it. No withdrawing of air, nothing of the sort. It's just gravity. So the steam is pumped in, the steam is heaviest, so the steam sits at the top of the autoclave, and the weight of the steam pushes the air out from down the bottom. That's all it does. So there's no drawing, there's just no vacuum, no getting air that's inside of the complex devices out of the complex devices. It's just gravity displacement. So the weight of the steam on the top pushes the air out from the bottom. And that's all that happens in that particular cycle. And the last set of that cycle, obviously, is then a very brief, maybe drying phase. Let's compare this flash cycle or type N cycle to the type S cycle. An example of a type S cycle would be one of these cassette sterilizers. So with the type S cycle, it is a quick cycle, yes, a fast cycle, but it's not the same as a gravity displacement or flash cycle, because this particular sterilizer has the ability to remove air, but using a steam injection positive pressure pulse displacement. So it uses a method to get some air out, not exactly the same as an N cycle, well, not the same as a B cycle, and certainly different to an N cycle. Let's summarize those three again so that we can remember them in a second. The type S can be designed for hollow items, and you can use cycles that contain pouches, or you can do things that are wrapped or unwrapped, obviously. The type S cycle, as we said, has got some form of assisted air removal. It is validated for certain items like dental drills, for example, but it's not validated for all types of devices. As I said, let's look at the summary. The best penetration, the best steam penetration, the greatest guarantee of getting contact with steam with all the instruments inside lumens, inside complex devices, is with the type B sterilization cycle, our normal sterilization cycle that we use for all the packs and devices that we have in our CSSDs. The type N cycle, as we said, is the immediate use steam sterilization gravity displacement type cycle. And there's no guarantee that we're going to get all of the air removed, especially not with complex devices. And then the third one is the type S, which is the special one, which is, for example, a cassette type cycle. So there, as you can see, there are three very different cycle types and three different end results at the end of the day. Right, so now we've reminded ourselves of how we're going to kill microorganisms using steam sterilization. We've looked at the three types, B, N, and S. B, the normal steam sterilizer that we use. N, the gravity displacement immediate use. And S, the special one like a cassette. Right, if for some unfortunate reason you really have to use immediate use steam sterilization, what are the rules that we need to follow? Let's have a look at that. The very first and most important rule, regardless of what you're doing in most things in the CSSD, is consult the manufacturer's instructions for use. So in this instance, we need to look at the instrument manufacturer's instructions for use to understand whether that particular device, that particular instrument, is actually able to undergo an immediate use steam sterilization process. Has it been validated for that process? The next important thing is having a logbook, because the process must be documented. We must record why we used immediate use steam sterilization, as well as it must be able to be traceable back to the patient. No implant devices should be sterilized using immediate use steam sterilization, unless, the only caveat or the only unless is if it says so in the manufacturer's instructions for use. Of course, no single-use items, and nothing that potentially was exposed to Creutzfeldt-Jacobs disease. So if for any reason there's a chance that your instrument or device was exposed to Creutzfeldt-Jacobs disease, you may not reprocess that in immediate use steam sterilization. All right, let's take a look at some of the examples of manufacturer's instructions for use. So this is an instruction for use for the Stryker System 6 battery pack, specifically the batteries, not the entire drill, just the batteries. What does it say here? It says if it's going in a pre-vacuumed normal steam sterilizer, type B, and then it goes in at between 132 to 134 degrees, and it can be wrapped, and it's a 4-minute sterilization time. If it's going in a flash autoclave, which it can do in an immediate use steam sterilization cycle, it goes in unwrapped in a tray for 3-minute exposure time and making sure that nothing touches the terminals. So if you needed to do a System 6 battery in an immediate use steam sterilization cycle, you know that it is possible, and now you know how it's meant to be done. Here's another example for a CUSA handpiece. This is a CUSA handpiece with the manifold tubing attached. This instruction for use describes both a flash or a wrapped cycle, and wrapped in a normal steam sterilizer cycle. You can see there unwrapped during flash, and it describes the sterilization time. Let's have a look at one of the Da Vinci instruments. Remember, Da Vinci's are complex devices. This particular one can go through a steam sterilizer. What does it say there? Right at the top of the instructions, it must be a pre-vacuum steam sterilization process. So Da Vinci instruments may not go through immediate use steam sterilization. Very simple. Of course, some of them can't go through steam at all, but some of them, of course, can. So those are all examples of manufacturer's instructions for use. Remember, if there's a court case, something goes wrong, the first thing the attorney is going to do is he's going to look for those instructions for use and say, did you follow them? Did you do exactly what it said in the instructions for use? Another important word or terms to remember, of course, is the difference between immediate use steam sterilization and terminal sterilization. Just a reminder. With terminal sterilization, instruments and devices are cleaned, packed, wrapped, sterilized, and stored for later use. With immediate use steam sterilization, of course, the instruments still need to be cleaned. They are not wrapped. They still need to be dried. They still need to be inspected. So that step must not be skipped. And washing it in the side, in the corner, in the anteroom with a bit of heavy scrub or whatever soap you can find is not the correct process. It needs to be cleaned properly, correctly, as it would normally be in the CSSD with the correct type of detergent. It needs to be dried. It needs to be inspected. Then placed inside of a tray, not wrapped, used for emergency purposes only, and only if it specifies in the manufacturer's instructions for use. And then, of course, it is not stored later for use because there's no sterile barrier. It is used immediately. So immediate use steam sterilization versus terminal sterilization. Immediate use steam sterilization is not the preferred method. there is a good chance that steam won't penetrate properly into all the nooks and crannies of the devices. And of course, then there's the risk, because there's a huge risk of when you transfer your items that have just come out of the immediate use steam sterilizer to the sterile field, there's a huge risk of contamination. So again, if I am using this type N immediate use steam sterilization cycle, what are the rules? Well, follow the manufacturer's instructions for use. We've already figured out now that a complex device, a device with a lumen, any devices of that nature are not necessarily going to be sterilized in this type of cycle. It may go through a sterilization process, but it doesn't mean that you're going to kill all of the microorganisms. As we said, we want the items to be unwrapped. So not wrapped, not in a container. They need to be unwrapped. No sterile barrier system applied. What does this AORN journal article teach us? It teaches us that there are 3 critical steps in immediate use steam sterilization. Number 1, cleaning. Number 2, sterilization following the manufacturer's instructions for use. And 3, transfer to the sterile field. So we need some form of aseptic transfer from the sterilizer to the sterile field to prevent recontamination of the item. Now, there's no magic answer on how to do that. You have to apply aseptic techniques, and how you're doing that will depend on your circumstances. Are you going into an anteroom? Are you going down the corridor? All of these things are going to put everything at risk. So really and truly, if you're using immediate use steam sterilizer, you need to stop and think why you are doing this, and are you really and truly doing the best possible thing for your patient. Yeah, so we've touched on some of the rules, but now let's go have a look at what the research and some of the printed literature and the guidelines can teach us around immediate use steam sterilization. Again, from the AORN, the original intent of immediate use steam sterilization was to sterilize an item or items that had been dropped or somehow became contaminated during surgery. It was never meant to be used as an alternative to terminal sterilization. Never. It was not meant to be used because we have a shortage of instruments. It's not why it was there. It was only there for emergency purposes when something dropped, when something went wrong in the middle of the case, that we had to make an alternative. And this really and truly is what it was designed for. But sadly, it's become abused. This journal also suggests that once a month, the infection preventionist, and I think the infection preventionist and the unit manager of the operating room should together go and inspect the documentation and the logs, the logbook for the immediate use steam sterilizer. Because it's quite obvious that if you're reprocessing the same instrument or same device repeatedly in immediate use steam sterilizer, you need more of those devices. You need to purchase additional instruments, and you can use that log as your evidence as to why you need to motivate to get these particular devices. You obviously need more. Let's have a look at this paper. So this paper was published in the American Journal of Infection Control. You can read the title, An Evaluation of Immediate Use Steam Sterilization Practices in Adult Knee and Hip Arthroplasty Procedures. Very sad if you are using immediate use steam sterilization for your arthroplasties. This journal article goes on to talk about the fact that because it's quite quick, it's convenient, and as a result, it leads to inappropriate use. And that was one of the main important points around this particular published paper, is that we've begun to abuse immediate use steam sterilization, and that has a great potential to increase our surgical site infections. The other thing this article stresses is that now, while you're doing this quick, go, immediately, hurry up, I need it urgently process, because you only have one of the devices, or for whatever reason it is, you now are using this immediate use of flash process, there's a tendency to skip steps because it's urgent now. And now it's quick, run, rush, quickly rinse a little bit, Do I actually really wash it in detergent? What detergent do I use? The proper one, an enzymatic one, or do I just use hand soap? Where do I clean it? In a rush like that, there is a good chance that we are going to skip a step. And that, of course, puts your patient at risk. Another important point is there has to be a valid reason for using immediate use steam sterilization. They go on to say that in their research of their circumstances, because they looked at a whole bunch of their hospital where this is performed, they're saying in only 10% of the times, 10%, where they're actually using immediate use steam sterilization for a valid reason. The rest of it weren't valid reasons, including shortage of instruments, because a shortage of instrument is not a valid reason. And in sometimes it could have been because of a missing instrument, for example. So what is a valid reason? Why are you using immediate steam sterilization? In this journal article, so this was published in 2020, and what it is it's an abstract from a presentation, an oral presentation given at the American Infection Control APPSA, it's called Congress in 2020, and this was all about how this particular hospital managed to reduce the immediate use steam sterilization purely with education and transparency. They go on to state again that immediate use is less effective and can cause the risk of increased surgical site infections. So they started this research project and this process to reduce immediate use steam sterilization as part of their surgical site infection improvement project. So that was their whole goal, was to reduce surgical site infections, so that they focused on immediate use. So they had a look at how often they use immediate use steam sterilization. They put into place a training program, and that training program included teaching physicians and nurses. They looked at some of their circumstances in the CSSD to see what they could do to improve the turnaround time, and sometimes some of this relates to trust. They then made the surgeon sign to acknowledge the risk each time immediate use steam sterilization was used. So there are a number of things that, I think about when I read that or I hear that. For example, do our doctors ever know that we used immediate use? Probably not. But it's quite important that we share it with them because there's a risk associated with it. At the end of the day, after having done this really good program of education, and making sure everybody was aware and that there was transparency with the surgeon as well. They managed to reduce their rates of needing to use immediate use steam sterilization, and they actually went through a period of 9 months where no one actually needed to use immediate use steam sterilization. Point is that it is possible to not use it. The World Health Organization global guidelines for the prevention of surgical site infections go on to state the following around downward or gravity displacement, which means immediate use steam sterilization processes. They say that they have many drawbacks, as sterility cannot be assured because they are less reliable than pre-vacuum sterilizers. They are not suitable for devices with lumens, and that immediate use of flash should never be used just to replace the lack of materials or instruments. And they say that, of course, you need to bear in mind the fact that immediate use sterilization delivers the instruments wet and very hot into the OR environment, and that in itself has another set of risks. This is a publication from 1999, a while ago, but a very relevant point, where 2 patients sustained burns because of immediate use steam sterilization. The first patient, they were doing an anterior cruciate ligament reconstruction. Patient had a partial thickness burn to her thigh because of the hot shaver housing was placed on her. On patient number 2, had a total right hip replacement. She had a full thickness burn when the weight of the hands-free retractor that had been flashed through the immediate use steam sterilizer made contact with her thigh. So another potential risk or area of injury for our patient. All right, so we've looked at some of the research and some of the guidelines, but what does it say about logbooks and documentation and quality assurance when it comes to immediate use steam sterilization? The AORN teaches us that all items must be traceable to the patient. So each time an immediate use steam sterilization load is run, a sterilization log should be completed, and it should record, or must record actually, the following information: the item that was processed, the patient information, so you would normally use a patient sticker, for example, the cycle number, the date, the time, and the temperature of the cycle that you used, the name of the sterilizer operator, and the reason for using the immediate use steam sterilization cycle. They go on to give this example of what could be put into the logbook, which I think is a really nice example. And it includes being able to obviously put down the dates, the operator's name, record whether a bioedic test was done that day on that sterilizer. If you use gravity displacement, did you do a biological? We'll talk about the biological in a minute as well. Was it a loner set? Was there water in the tray? Were there holes in the wrapper? Did the item get contaminated in theatre? Maybe you dropped it. Was, when you opened the set, was there maybe no chemical indicator, or the chemical indicator didn't pass, so you needed to reprocess it in immediate use? Or did you open the set and an item in the tray was not properly sterilized, so that's why you needed to put it in immediate use? Or you opened a container and there was no filter in place, so you quickly put it in the immediate use. The autoclave in CSSD was broken, that's why you used immediate use. So very important to understand why it is you're using immediate use steam sterilizer, because you need a valid reason. And if you don't have a valid reason, it shouldn't be something that you're using. Quite simple. Very nice example of the logbook. Maybe take a photo of this, give you a second, because this is something to improve. If you don't have a logbook, you need one. And if you do have a logbook and you don't have all of these details in it, you should look at improving what's in your logbook. All right, the AORN goes on to teach us that we need to put chemical indicators inside the tray. Of course, inside the tray in the area where it's hardest for the steam to penetrate. It tends to be sometimes in the middle, maybe in opposite corners of the tray, depending, of course, on the size of the tray that's in there. Reminding you that there are two basic types of chemical indicators, one which is based on a physical change and one which is based on a chemical reaction. So the one on the left is the physical change. What happens there is the chemical indicator, that little pellet melts when it's exposed to the sterilant, and the pellet changes from a solid into a liquid, and the liquid then wicks along the paper. And the other type of indicator, you've got chemicals in the indicator ink, and the chemicals will then change color when the ink has been exposed to the sterilant for the correct amount of time at the right temperature. So putting a chemical indicator into your tray is one of the ways of making sure what? That steam penetrated into the tray for the right amount of time at the right temperature. An example of the right type of chemical indicator to use within an immediate use steam sterilizer is the one on the right. So this one is designed for flash sterilization as such. Why? Because remember, it's a very wet process. There's very poor drying in this type of cycle. So you don't want a chemical indicator that's going to leak chemistry all over your instruments. So please use a chemical indicator designed for flash. This particular one has got a coating on it to make 100% sure that the ink doesn't end up on the instruments, which in itself would be another problem for your patient, or another potential problem for your patient. Now, in this guideline, it goes on to say, now, if you've had a dire emergency, and I do mean a dire emergency, and you have to sterilize an item which is an implantable item, thing that's going to stay in the patient, you really must notify infection control, and you must do a BI. They say in this guideline, you need to do a BI in the load, and you need to quarantine the device. Which, how do you do that? Because you can't keep it sterile until a negative result or readout is available. What are you going to do? Leave the patient on the table till you get a readout? I suppose it depends on the type of BI used, and it depends on the length of the procedure that you're doing. but at least doing a BR is something that is very, very important. And maybe you want to consider doing a BR on a daily basis if you're using your flash very often. This line from the World Health Organization's Global Guidelines for Prevention of Surgical Safety is one that resonates with me. It's the duty of the sterile services manager or the person in charge of the sterile services department to ensure that a medical device does not leave the unit unless it is completely safe to use on a human. Very important, and I think everybody in CSSD takes that role seriously. But now, if you're doing this process in the anteroom, the item's never leaving your theatre. It's going somewhere to the anteroom, the scrub room, the basin, the corner, and then into a flash or immediate use steam sterilization process. There's no CSSD supervisor who's taking control here, and it is you. It is the scrub person's responsibility. You're now taking control. Can you please make sure that you do the process correctly? If you are using it, use it for an absolute valid reason only. You're taking responsibility for the patient's care at the end of the day. You do normally anyway. I know that. You're a good scrub sister. We know that we take responsibility, but here's another added responsibility. Please make sure that if you use this, you use it correctly. Ultimately, what we've covered today and what I'm trying to get across quite clearly is that immediate use steam sterilization is a complex process. Must only be used for the right reasons, for valid reasons. It can be very risky to use immediate use steam sterilization. All of that urgency and quick, hurry, move along is risky. It really and truly is. If you really and truly have to use immediate use steam sterilization, then you must follow the rules. In a court case, will you be able to stand there and say, what are you going to stand there and say? Yes, I read the rules, or no, I didn't have the rules for that particular drill. I have no idea whether the drill can or can't go through this immediate use steam sterilization process, but I do it every day anyway because I don't have enough drills. That's really and truly not going to fly well. I've stood in court, I've stood there trying to defend my own actions, looking at what I'd done for the case that I had scrubbed for these patients that had died in surgery. I had to justify exactly what was going on. So please go with my circumstances, go with my experience. Please be very careful. If you are doing it, you're accountable. Do you have a logbook? Are you recording all the right things in the logbook? Is this traceable to the patient? And have you done all of your validation tests? Have you done your BRs? Have you used the chemical indicators? Have you used the correct stuff? Thank you very much for joining today. Hope you enjoyed the session. If you have any questions, Kurt will be around to answer them. If there's things we can't answer today, we will make sure that we get back to you. Thank you so much.